Hello and welcome to the Red Chair series. I'm Lisa Ishii, Senior Vice President for Operations for the Johns Hopkins Health System. Delighted to be joined this morning by Dr. Wendy Post. Welcome, Dr. Post. Please tell us your role at Johns Hopkins.
Thank you, Dr. Ishii. It's a pleasure to be here today with you. I am Lou and Nancy Grasmick Professor of Cardiology. I am a preventive cardiologist, and I spend the majority of my time doing research.
You are world-renowned for your research on prevention and prediction of cardiovascular disease, and in particular, how genetics can influence risk for cardiovascular disease. Tell us more about what you've learned.
I've been particularly interested in genetic risk at a population level. We understand so much more about how to screen for and prevent cardiovascular disease. We know that 1 in 250 people have heterozygous familial hypercholesterolemia. This is a genetic form of risk for cardiovascular disease that is manifested as an elevation in cholesterol. And it's really important that we identify people who have familial hypercholesterolemia, since we have proven therapies to reduce risk related to high cholesterol.
That's really interesting. So what if I don't know much about the details of my family history of cardiovascular disease? What if I just know that someone in my family died of heart disease?
Well, we recommend that all adults and also children be screened with a lipid profile. And we can identify people who are likely to have a genetic form of hypercholesterolemia or high cholesterol based on the severity of their cholesterol elevation. So if you have one copy of a familial hypercholesterolemia genetic mutation or variant, then you'll have moderate elevations in cholesterol, maybe 250 or 300 milligrams per deciliter. And these patients are at significantly increased risk for heart disease and need to be identified early so that they can be treated with proven therapies. Very rarely, maybe 1 in a million people will have 2 copies from their mother and their father of a familial hypercholesterolemia gene. And these people are at risk for heart disease at a very young age. So it's also recommended that children be screened to make sure that they don't have severely elevated cholesterol that needs treatment early on in life. I also wanted to talk about another form of genetic risk for heart disease, which is called lipoprotein(a). And this is a special form of cholesterol that we haven't talked about as much until recently. And we know that people with elevated levels of lipoprotein(a) are at increased risk for heart disease. And more recently, we've also learned that they're at increased risk for aortic stenosis, which is a blockage in one of the valves in the heart. And what's really exciting is that now we have newer therapies that are being tested that can lower Lp(a) levels. These medications are currently in clinical trials, and we anticipate that they'll prove that lowering Lp(a) will reduce risk for heart attack and potentially for aortic stenosis. There's a phenomenon called cascade screening, where if I see a patient who has very high cholesterol or very high Lp(a), we recommend that all their first-degree relatives get tested so that we can identify people at increased risk for heart disease through genetic risks.
That's fantastic. What a great advancement. Tell us more about non-medication things that we can do to decrease our risk for heart disease.
The American Heart Association has emphasized the importance of life's essential 8. These include eat better, be more active, quit tobacco, get healthy sleep, manage weight, control cholesterol, manage blood sugar, and manage blood pressure. So we all should pay attention to life's essential 8 and do what we can to reduce our risk for heart disease. I suspect that in the future, as we learn more, we won't only be doing life's essential 8, but we'll also want to understand our genetic risk, because if we know early on that we have a genetic risk for heart disease, then we can do even more to lower our risk, both through lifestyle modification and also through proven medical therapy. We've learned so much about effective ways to reduce risk for heart disease through research, much of which has been funded through the American Heart Association.
Dr. Post, your work in the prevention and prediction of heart disease is truly extraordinary. Thank you so much for your contributions, and thank you for joining us here today on the Red Chair series.
Thank you so much for having me. It was a lot of fun.